You're listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, get the facts on ACA insurance sales and 5 myths about selling ACA health insurance plans. Written by Emily Ryan. If you're looking to enter the under 65 health insurance market for the first time, you may have a few questions, or you may have more than a few questions. We are here to debunk 5 ACA insurance sales myths. Our hope is that with some clear guidance from the knowledgeable staff here at Ritter Insurance Marketing, the FMO that powers this podcast, you can feel comfortable finding your clients the ACA coverage that best suits them. Let's get into our list of myths. Myth number 1, the ACA is too complicated to understand. To first-time agents, the ACA may be intimidating and complex. However, there are helpful resources that can simplify it. The Centers for Medicare and Medicaid Services, our friends at CMS, as we call them, has compiled a series of beneficial web pages for agents and brokers who are just getting started and trying to understand the ACA. These documents outline updates on the American Rescue Plan Act, special enrollment periods or SEPs, and information on marketplace registration. Many of these are broken down into easy-to-read PDFs or are simple web pages featuring information so you can quickly learn what you need to know before your next client meeting. There's an FAQ section for agents and brokers that answers a variety of questions. And if you're looking to take a deeper dive into the protection that the ACA granted to make healthcare affordable for more Americans, we will have the link to a detailed summary of the ACA in our episode notes. And as far as Ritter resources, our ACA 101 blog post breaks the ACA market down into understandable parts to help you in your sales journey. We also have a team of dedicated support agents ready to answer your questions and help you navigate the ACA. We will have the link to reach out to that team in our episode notes as well. Myth number 2, my clients have to register for coverage through the federal marketplace. The marketplace is the central hub for ACA or under 65 health plan sales. There are 2 types of marketplaces, the federally facilitated marketplace, or FFM for short, and state-based marketplaces, or SBMs. The federal marketplace, HealthCare.gov, or an approved EDE such as Health Sherpa, is where individuals can go to purchase an ACA health insurance plan in an FFM state. If an individual resides in a state that does not participate in the federal exchange, they would purchase an ACA health plan through that state's unique exchange. So, for example, someone here in Pennsylvania who wants to buy an ACA health plan would do so on Penny. HealthCare.gov features a marketplace finder on their website, so we will have the link to that resource in our episode notes. Couple other important notes to mention. Clients who purchase an ACA plan through a state exchange may still be eligible for an ACA subsidy. ACA plans may also be purchased directly from the carrier. Any plans purchased outside of the federal and state exchange are commonly referred to as off-exchange plans. However, ACA subsidies are not available to be applied to plans purchased off of the federal or state exchange. For agents partnered with Ritter Insurance Marketing, after completing the registration with our website, agents gain access to a free Health Sherpa account. Health Sherpa is an approved EDE or Enhanced Direct Enrollment Platform. It enables independent agents to enroll clients in ACA plans without the fuss of the marketplace. Myth number 3. Only clients who are very poor qualify for ACA coverage. This one is simply not true. Someone is eligible to enroll in marketplace health coverage if they live in the United States, are a United States citizen or national, are lawfully present, and are not incarcerated. Medicare beneficiaries are not eligible for ACA health coverage and are not eligible to purchase health coverage through the marketplace. If you're not familiar with how things work on the Medicare side of healthcare, there are resources available on HealthCare.gov that will be linked in the notes to help you better understand how both Medicare and the marketplace work. Often, individuals with lower incomes can receive subsidies in the form of tax credits and cost-sharing reductions that make marketplace plans more affordable. For subsidies, a client's income, household size, and employment status are considered. To find out if your clients qualify for a tax credit, the Internal Revenue Service has resources you can use on their website. For clients who do not qualify for subsidies or tax credits, consider an off-exchange ACA plan. In order to cater to clients in all income ranges, many carriers offer on and off exchange plans, and agents can sell both types of plans. Myth number 4, there's no money in selling under 65 health plans. A few years ago, carriers paused commissions on under 65 health products. In the time since then, much has changed, and there's plenty of potential in the under 65 health market. With ACA, commissions are typically earned per household member per month. That means that when multiple family members enroll in a plan, you can earn commission on each individual's enrollment. All carriers reward an agent with initial commissions as well as renewal commissions when the client re-enrolls in an ACA plan for another consecutive year. Even if tax credits lower your client's monthly premiums, you'll still collect the full commission. Your commission is yours, whether the client requires a lot of attention or simply a few check-ins. Additionally, agents can cross-sell ancillary or complementary products with an ACA plan and build a pipeline for future Medicare enrollments. Selling multiple types of products creates the potential for a well-rounded portfolio so you can reach clients of all ages. Ritter makes it easier for agents thanks to our Under 65 Health team. This team specializes in helping you make the most of selling ACA plans. We can also notify you of competitive carrier commissions and additional incentives. And then our Ritter Docs carrier pages have news on the latest sales incentives that can help you reach your goals. Myth number 5, it's too difficult to get certified to sell ACA plans. Marketplace certification is free, and the full version of the training must be completed only once. Recertification is required annually, but it is typically shorter than the initial training. Some states may require additional training or certification, but you do not have to certify to sell ACA products with each individual carrier. Here at Ritter, we've assembled step-by-step instructions on how to become certified with the federally facilitated marketplace and with each state-based exchange. We've taken the time to answer some frequently asked questions about ACA certification and training requirements in a post on the Ritter blog. That post, as well as the other resources we've mentioned in this episode, will be linked in the episode notes. So be sure to check those out by tapping on the title of this episode. After you're certified, you are ready to start selling ACA plans. For access to plans and to get started on contracting, register with Ritter Insurance Marketing and tell them that the Agent Survival Guide sent you. Bottom line, Even though myths surround the ACA, it doesn't have to be confusing or stressful. We've taken the time to debunk 5 common myths here, and we're dedicated to supporting you as you start selling under 65 health plans. And with these myths debunked, hopefully you'll see that the under 65 health insurance market is a little less intimidating. You should feel comfortable going into your next client meeting, and we're looking forward to joining you for incredible new sales opportunities. But if you do still have questions, we are here for you to answer those questions and offer a little bit of guidance as you navigate what is next for you. Thanks so much for taking the time to listen. As you're taking a look around the episode notes, we would love it if you took a moment to tap that follow button. It's a great way to support the show. It lets us know we are doing a good job, and we really appreciate you taking the time to listen and follow along. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and proofed by Emily Ryan. Recording and production by me, Sarah Rappel. Podcast design and episode artwork by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.